Hello and welcome to Arirang TV's special continuing coverage of the COVID-19 pandemic. I'm Min Sun-hee. This past weekend, Korea hit an important milestone in its fight against the pandemic, with more than half of its total number of confirmed patients making a full recovery. The fight is far from over, but this milestone is indeed offering quite a few a ray of hope. Meanwhile, in today's broadcast, we'll be talking about the role that transparency and open disclosure of information have played in efforts to battle the virus here in Korea. But first, we have Kwon Soa and Noaram with us in the studio with the headlines. Welcome.
Hello.
Hi.
So I will start with you with the latest here in Korea.
All right. We have now a downturn in cases. We have double-digit cases of new confirmed cases after cases seem to be on the surge on the weekend because we saw numbers in their hundreds in the past couple of days over the weekend. Speaking of the weekend, how did you guys actually spend the weekend? Were you at home?
I think I spent the weekend at home. What about you, Adam?
Likewise, self-isolating.
Right, yeah, I think
we should.
Yeah, we should.
Good that we are all abiding by the social distancing measures. I was also 48 hours at home, but I can't complain. But I know that it isn't easy for many people because the weather is getting nicer. But the pandemic goes on and we really must stay on alert. Now, the government announced today 78 new cases have been confirmed as of Monday, 12 a.m. and 29 of those are cases from overseas. 13 were detected through testings at the airport and 16 were reported by local governments. Now, 27 patients are Korean nationals, only 2 foreigners, and with that we have a total of 476 imported infections. Around 90% of those patients are Korean, and that is why South Korean Prime Minister Chung Se-kyun on Monday urged for students that return to Korea to really abide by the government's measures and the quarantine measures, in fact, in concern of new community spreads. Now, especially in the metropolitan areas, if we take a look at our map, with the rising imported cases, Seoul and nearby Gyeonggi-do province are locations that need extra caution, as many of people entering from abroad tend to stay in the capital region. Seoul has 16 cases, Gyeonggi-do province 15, Daegu and Gyeongsangbuk-do province have 25 cases combined. And what's noticeable is that we also have many cities that have not a single new case, like Sejong City, Daejeon, Chungcheongnam-do province, or Gwangju. In total, South Korea has now 9,661 cases and 158 deaths. While the number of new cases is way below 100 this Monday, almost 200 people have completely recovered in the span of a day. Not only has the number of daily discharges exceeded the number of new cases, but the total number of recovered is now above the number of people being treated in quarantine, which means the recovery rate is now over 54%.
I see. I understand that isolation facilities and hospitals near the airport, however, were very busy, though, because quarantine measures are centered there, because cases abroad have yet to reach their peak.
Exactly, and that's why officials in Europe and the US are saying that the worst is still to come, and there is no sign of alleviation in many places around the world. For instance, US President Donald Trump said on Sunday local time the highest point of the death rate is likely to hit in 2 weeks. With that, he also extended social distancing guidelines until April 30th. Now, the virus is spreading exponentially in the US, which, according to recent figures, has around 140,000 cases. We are seeing alarming numbers in Italy, more than 97,000 cases and more than 10,000 deaths, which means the fatality rate is at over 11%. Meanwhile, Spain may become the next country to surpass China's number of total cases, and the UK's cases grew higher than Switzerland on the weekend. And now, not on our table here, but Japan is also seeing more cases, infections of at their hundreds every day, and that following its recent postponement of the 2020 Tokyo Olympics. And also a continent we haven't been talking a lot about is Africa, which on Sunday reported at least 4,200 cases in total now. And the total number across the world crossed 720,000, with the death toll standing at 34,000.
No, that is alarming to say the least. Meanwhile, here in Korea, businesses and individuals, like elsewhere around the world, are suffering, and President Moon Jae-in has announced some relief measures. Aram.
Yeah, so President Moon announced that the Korean government will grant what he's been calling an emergency disaster relief money to a majority of low-income Korean households in a one-off stimulus program. He was speaking during a third session of the Emergency Economic Council, which was set up to deal with the economic fallout of COVID-19. He also unveiled another multi-billion-dollar supplementary budget on top of the one that we had earlier. And the relief money is mostly aimed at low-income households, as I said. In terms of how much each household will get, a four-person household will get 1 million won, which is approximately $820 for each household that do have a relatively low income. Around 14 million households comprising of 35 million people will be eligible for that aid. The president also said the government would relieve the burden on low-income families and small shop owners, as well as the self-employed, for fees for utility bills such as electricity, as well as what is known in Korea as the four social insurances, so health insurance, national pension, the employment insurance, and industrial accident compensation insurance. Now, this insurance is usually what people pay when they are employed, and they will get reductions in such fees or be allowed to postpone monthly payments. And Finance Minister Hong Nam-gi just made an announcement a few moments ago about the details on that, which will be available on the government website as well. And the emergency funds, we have to pay for all this, and the government is planning to pay for all these relief measures through the second extra budget, which Moon Jae-in hopes will be passed by Parliament after the April 15th general elections. Well, not too far after that, shortly after that. And as I said, this follows the near 10 billion extra budget that we had earlier.
Right. Concerns are also rising over imported cases, and I understand the Prime Minister has announced some ways to tackle this problem.
Yeah, so Prime Minister Chung Se-kyun said the government will enforce a 2-week mandatory quarantine on all arrivals to Korea. Starting Wednesday, so in 2 days' time. The measures were in place for certain regions, as we've been reporting last week, but will now apply to all overseas arrivals, as I said, both short and long-term visitors. The policy will also apply to South Korean nationals as well, so it's not just foreign nationals. Those without local addresses are to stay in government-designated facilities at their own expense. There have been concerns, especially in the Seoul metropolitan area, as I was alluding to earlier, over imported cases. There is a high concentration of imported cases in Seoul and its surrounding areas. So these measures have come about because of the concerns of cluster infections and overseas infections.
Right. Adam, the Prime Minister also touched upon the topic of schools reopening after speaking with school authorities.
That's right.
There's still some debate on whether schools will be opening next week.
Yeah, so the overall consensus among the school superintendents is that they are opposed to the schools reopening on April 6th, which is exactly a week from now, which is when the government announced the school semester would start. So that was the third time, in fact, that the delay happened, but now we could be possibly looking at another delay. These superintendents obviously feel that it is still too early for COVID-19 to be deemed safe for schools to reopen, and they are recommending that the semester be postponed even further. And the government will announce its decision on the matter within the next day or two. Now, one of the measures the government is thinking about is starting the semester through online or virtual classes, which we've seen in universities in Korea already. But obviously that means a whole revamp of the infrastructure and preparation to go with that, as well as some technical glitches that have happened in universities. And as things stand legally, the government is allowed to delay the semester until April 17th. So we could see that. That's 2 days after the election. So we could see that happening. Yeah.
I understand our testing kits have been receiving much praise from abroad as well, and
right.
they might become the global standard, is it?
Yeah, so many countries have obviously described Korea's diagnostic capability as a model to follow, and now Korean testing kits are a step closer to being available on the international stage. That's because 3 Korean-made COVID-19 test kits have been approved by the US FDA, and this will allow the manufacturers in Korea to sell their products in the United States as well as worldwide. So it will prove a huge stepping stone for Korean test kits on the global stage.
All right, Aram, Soa, thank you for the headlines. It's a little after 2 o'clock in the afternoon here in Korea, and we're now poised to join the Central Disaster and Safety Countermeasure Headquarters for the latest facts and figures on COVID-19. Now, it's been disclosed that all arrivals to Korea will be required to self-isolate for 2 weeks, regardless of their departure cities, starting from the 1st of April. This broader quarantine measure comes in response to rising concerns of imported cases in recent days, which officials here believe will continue to rise in the weeks to come. Figures by our SOA earlier on show that we had 78 new cases today, raising our total to 9,661. Of those 78 cases, 29 are from abroad and 13 were identified at the airport. We now have our briefing.
We'll begin our regular briefing for March 30th, Monday, on the coronavirus outbreak. As of today, midnight, the total number of confirmed cases stands at 9,661. This includes 476 imported cases from abroad, and among which 40 were foreigners. And yesterday, there were additional charges of 195 who were discharged following full recovery. And now we have a total of 5,228 on discovery, which is about 50% of our total confirmed cases. And our death toll increased by 6 yesterday. And I extend my deepest condolences to those who have passed away, as well as the bereaved families. Yesterday, all of the 6 death tolls were 4 of them were above the age of 80, and 2 were above the age of 70. And 5 was in the region of Daegu and Gyeongbuk, while 1 was in the other region. And our fatality rate is about 1.64%, which has increased slightly. And nationwide, 81.1% are related to cluster infections, and 11% are still undergoing investigation. And the regional breakdown is as follows. In Seoul City, we had 16 new cases yesterday, and most of them were imported cases, and also they were related to the cluster infections that were reported at the Manmin Central Church. And in Daegu City, we had 14 cases yesterday, and we have an additional cases confirmed at the nursing hospitals, including the second Miju Hospital. And in Gyeonggi-do Province, we saw 15 more people confirmed cases. Most of them were the imported cases from abroad, as well as the contacts of those who have been earlier confirmed. And in Gyeongbuk, 11 more have been confirmed, and they were related to the nursing hospitals and nursing facilities. And in airport quarantine, we had 13 new cases yesterday. And within Seoul, there was the Manmin Central Church located in Gurogu district, and we have 10 new cases here. And from 25th of March until now, we had 23 confirmed cases. 19 of them were from the church, and while the rest were the contact family members. And also we carried out the isolations and screening for the 78 people who had been come into contact. And in Daegu City at Dalseogu, there was the hospital of second Miju Hospital, and currently we have about 135 confirmed cases, and 133 cases of them, most of them were inpatients, while 6 people were the staff members who were working there. And these confirmed cases have been moved to the designated hospitals for treatment, and we are also moving the other patients who were tested negative. And in light of the increase in the percentage of imported cases, we will give you some breakdown of the numbers. And yesterday we had 29 new confirmed cases from imported cases, 1 from Asia, 1 especially from Indonesia, and 12 from Europe, and 12 also from US. And 13 were reported in the airport quarantine, while the rest 16 were related to the cluster infections that happened in the society. And a majority of them were Korean nationals. And so we have about 476 imported cases now, and 50% of them who were reported at the airport. And 91.6% were Korean nationals, and the rest of the 8% are foreigners. And as the rise of the imported cases continue to be witnessed, the government is also enhancing our screening measures. Right now, we have mandated self-quarantine for only those who are arriving from US and Europe. However, starting from April 1st, we will mandate all of the entrants coming into the country starting Wednesday, that is April 1st. And also for foreigners who were on a short-term visit, they will be also be under a 2-week mandatory self-quarantine, except for very special cases. And if they do not have a residence here in Korea, we will have a designated hospitals or facilities that will house these short-term foreigners, and they would have to pay for their own expenses. And the screenings, the fees of the screening, and when they were confirmed, the treatment will be burden of the government. And this is not a privilege, rather it is one of the duties for the government to pay for these expenses. So that is how the government will be planning to pay this. And as for the foreigners who breach the self-quarantine measures, they will be subject to a fine of $10 million or imprisonment of 1 year. And the foreigners, according to the legal aspects, they could be forced to leave the country. Therefore, we once again urge everyone to abide by these rules. And for all of those who are coming in from abroad, we ask you to comply with our quarantine measures and screening measures. And when you go home, please use your own vehicle or the designated transportation, including airport limousine or KTX that have been reserved exclusively for all of you. And during isolation, they also need to refrain from coming into contact with family and other cohabitants, and they need to strictly follow the self-isolation guidelines. They should need their own items and minimize people-to-people contact and practice 2-meter social distancing and carry out a regular ventilation as well as washing of your hands and sanitizing your hands. So this is a must for not only for the person who is on self-isolation, but also for the rest of the family members. For any persons who suspect onset of COVID-19 symptoms, those are advised to call the call center or report through the application so that they could receive screening as soon as possible. And all of the international travelers who are coming back to Korea, they also need to go under self-quarantine and comply with the personal sanitary practices as well. This week marks the second week of our enhanced social distancing campaign measures. Thanks to the many public who have been taking part in this campaign, we were able to curb the large-scale outbreak. However, we also once again urge that you refrain from religious gathering, going to indoor fitness or sports facilities, or other activities that make it easy to come in close contact with other people in close spaces. Thank you very much.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest on the COVID-19 pandemic here in Korea. As emphasized, the government has now called for a 2-week self-isolation period for all arrivals to Korea, regardless of their departure countries. Visitors without local addresses will stay in government-designated facilities at their own expense. Now, this broader quarantine measure comes in response, that is, to the growing number of infections among those from overseas. The COVID-19 outbreak has profoundly altered the lives of millions of people across the world. Korea is no exception. And for more on the changes in social landscape here and elsewhere around the world, we have Andres Sanchez-Braun from Spain's EFE news agency. Thank you for being here, Andres.
Thank you for having me.
Perhaps we can start with the situation in Spain, which is battling the second largest outbreak in Europe after Italy.
Exactly, as you've already mentioned, the situation is bleak. It's not good in Spain right now. We stand at above 80,000 infected people. That's almost as much as China. And 6,800 people at least have died already of COVID-19, which is more than double what we've seen in China. So the situation is far from good. And the government actually, from today, has banned any non-essential economic activity. Up to now, there was a state of emergency declared, but that meant that still people could go to work if they could not perform their jobs from home. From today, that is not the case anymore. We're basically on the same situation as Italy right now, yes.
I see. Andres, Spain is returning test kits that it bought from China due to defects and low accuracy rates. Does this mean that the number of confirmed cases in Spain may be higher?
Oh, it's definitely higher than 80,000, I can guarantee you that. I don't think it really has to do with these non-effective Chinese test kits, because these test kits actually were found to be not accurate very, very early, probably within the same day they were received. These are not the test kits that have been used up to now. The problem in Spain is basically testing, as we've seen in Korea, hasn't been performed on that level. It hasn't been massive testing, and now it seems it's a little bit too late to fix things. It's going to take time, yeah.
I see. On an individual level, Andres, how is the public in Spain dealing with the outbreak, and when you compare it with the people here in Korea?
Well, people are coping. They've been on lockdown for 3 weeks from March the 14th, as I recall. It's been tough on the population. People are the ones that are actually told to work at home, that can work at home. They haven't left their places except for what we're seeing, basically buying daily necessities, food, maybe medicine. That's about it. And of course, it takes a toll on people's, mental health. I think it's very tough on people. Of course, Koreans have done a great job so far, but they haven't been forced to confine themselves. So I think comparing the situation up to this point is very difficult. Yeah.
Right. Well, Korea reported its first case of the virus on January 20th, and it's been a little more than 2 months now. In this next video, we take a look at our community amid this contagion through the eyes of a Turkish journalist who took the video and lives in Korea.
Hello everybody, my name is Alpago. I am from Turkey. I am a journalist, and then 16 years ago I come to Korea. Until that time to now I have lived in Korea, and today I'm gonna talk about coronavirus and supply problem. Let me talk about Turkey's situation firstly. Now in Turkey is really big and huge problem. That's why all of cafe, shop and gyms, cinema, all of these shops just shut down. And then the second big problem is supply problem. In Turkey, this is really difficult to buy gloves or chemical cleaners or masks on the shops or big stores. Actually, this is not a problem in Turkey. You can see that problem also in European countries. But in Korea, we don't have supply problem. You can find everything in everywhere. In Korea, people don't have any afraid about these problems. Now I'm gonna show this. As you see in supermarket, there is no supply problem. Everybody can buy everything which they want. And as you see, there is no tissue problem, no problem. You can buy everywhere, every time. But mask still we didn't buy. Wait a minute. 마스크 안 파세요? 그럼 마스크 살려면 어디서 사야 돼요? 약국 가야 돼요? 알겠습니다. As you see, they put some announcements here. For example, this one is if you buy mask, you have to use or you have to show your identity card. And then this is we finished already today's mask. I mean, there's one system to provide mask to current citizen, and now I'm gonna introduce that system. This is 5-day rotation system for buying mask in Korea. If you buy mask, you have to check your birth year, the last number, and in Korea we use application to find pharmacy to buy mask. That's why Korean people don't have any difficulty to find open pharmacy to buy mask. Finally, we find our pharmacy shop. I have to show my identity card. 안녕하세요. 주민등록번호. 저 수요일에 못 샀어요. 네. 감사합니다. As you see, I buy 2 masks and very cheap. 2 pair mask is just 3,000 won. And now I'm gonna explain why Korea don't have supply problem, especially mask or tissue problem. Korean government and Korean peoples have a big collaborate on the fight with coronavirus. Korean society also very peaceful despite the corona crisis, and I wish this peaceful atmospheres also spread to another countries. Thank you very much.
Right, now that was a video by our Turkish counterpart. Andres, what are your thoughts about how members of the public here have taken it upon themselves to ensure their well-being and safety?
People's reactions here have been remarkable, of course. Korea has been through this tough situation already. I mean, I would say especially since the Daegu situation started getting bad there, which is, it's been more than a month. I mean, and I think so far, as I said, it's been remarkable, but I can say that I see some complacency sometimes now, and I think as Prime Minister Chung the other day underlined, that's actually one of the toughest challenges ahead right now. Keep people in the mentality of how we need to keep social distancing activated for the time being. This is a long-term battle, definitely.
We also saw this in the video, but Koreans have not been crowding supermarkets to hoard on basic necessities, and masks have been distributed to members of the public in a relatively orderly fashion. What do you suppose has made this manner of consumption possible?
I really wouldn't know what to say, but yes, it's remarkable that in Korea there hasn't been any hoarding of any kind. In Spain there was a couple days, especially when the state of emergency was declared, people were buying lots of rice and of course toilet paper. I still don't know why toilet paper is that this super demanded necessity in these days. But I don't know. I've been told maybe a mentality in Korea also has to do with the fact that people are used to living a little bit in a state of emergency. The fact that, you know, a neighboring country as North Korea, well, technically these two countries are at war, and you know, people kind of live maybe in a little bit of a sort of a state of emergency already. That's why they don't panic when situations like this happen. But this is a wild guess. I really wouldn't know want to
All
say.
right. All right, Andres, thank you for
Thank you
that.
so much for
But do
having
stay
me.
with us. We have more talks coming up on transparency this time around in our next segment. Meanwhile, to our viewers here and elsewhere, should you have videos that you would like to share on COVID-19, feel free to send them to us. Among the words of praise that Korea has garnered from its counterparts are those related to its transparent disclosure of information as part of efforts to contain the spread of the virus. For more on this, we have Professor Park Ki-soo from Korea University. Welcome, Professor Park. And we have Andres Sanchez-Braun from Spain's EFE news agency. Thank you for staying, Andres. Professor Park, during the G20 video summit, President Moon Jae-in highlighted Korea's information transparency as a key contributor to containing the contagion. Would you agree?
Yeah, absolutely. Because Korea had a bad experience during the MERS outbreak back in 2015. So we have now two ways of getting out information. The first one is a daily briefing. We have daily briefing 2 times a day. In the morning, mostly the Ministry of Health and related departments focus on the lots of medical equipment or quarantine measures and how many people are needed to improve the medical system, and also other quarantine measures, especially there are lots of people coming from overseas. Even though there are maybe 90% of people are Korean national, so they are dealing with this kind of stuff. And also another briefing is KCDC, as we already saw. They are mostly dealing with clinical data and how many people are isolated or contacted, and especially focus on the contact tracing. This is one of our great, maybe a good tool to contain the virus. So those are the 2 briefings a day. And also last one is about information contact tracing using lots of IT tools. So that people can kind of try to avoid the situation, especially the close contacts or casual contacts. Those are the 2 ways of information dissemination.
Right. Now, we also have another voice from the academic arena with regard to Korea's transparent manner of information sharing. Let's listen to what he has to say.
Whenever there's an infectious disease outbreak, the single most important thing to do is to communicate to the public and to the medical profession clearly and thoroughly and consistently, so that everyone speaks with the same voice. That way, the public has confidence in the public health department and also in the government. That hasn't always worked so well here in the United States, I'm afraid, where there are sometimes conflicting messages. I think the entire South Korean experience with COVID has been an example to many other countries, the United States also. So the widespread testing, the quarantining, and letting people know who's quarantined has been a very successful activity for you guys, because you have really controlled the outbreak so far.
Andres, what would you like to highlight about the Korean government's disclosure of information?
Well, Professor Schaffner already pointed out, I think, the most remarkable things. And I mean, it's the amount of data that is released every day. We are seeing different formats, different languages being released, and in such a timely manner. I mean, in this respect, I think Korea has done so far the best we've seen in this pandemic when it comes to transparency. I mean, just having, for example, the information available on knowing, for example, that 81-point-something% of cases actually do have an infection path that has been identified is remarkable data, and I'm afraid not many countries are nowadays capable of doing this, yes.
Andres, if you have any question for our Professor Park at this point, please go ahead. Actually,
yes, I'd like to know his opinion on this system. I mean, how is it possible that the government is testing massively, that it's testing thousands of people every day, and it's also updating citizens when an infection path is found, and this happens almost on a daily basis. How are authorities coping with such big amounts of information and then disseminating them?
Before I answer about that question, the professor is really, I mean, appreciate our, compliment, but just as many of Korean people think, it's just done so far. So we have to do a lot of job. So, but anyway, it was not easy, and it is not easy because of we had a bad experience, like I told, during MERS outbreak. At that time, there's no almost contact tracing system. So we cost a lot of lives, and also a lot of loss economically. So at that time, we try to focus more on the contact tracing, because that contact tracing information could have a lot of chance, or give a lot of chance to the people to avoid the situation, or to prevent and control measure. So at that time, a lot of government departments, including KCDC and other telecommunication company, credit card, and police department. So now we use 4 ways of tool. The first one is we have to, the KCDC gather information, especially the security camera footage from police department, and then another one is credit card records. This is from the financial authorities and also by the 22 credit card companies. And next one is a cell phone GPS system. Lots of foreigners is totally amazed about our GPS system. So we used that data from the 3, we say SK, LG, and other telecommunication companies, and they give me a lot of information. And the last one is a transportation card, like a subway and bus. So those 4 information just put together, and the KCDC EIS, we say epidemic information service officers, they just screen it and put together, and so that when, let's say, someone just tested positive, and then the officer tried to get that information and who was there or not, and what kind of people visit that place. So we screen out who's going to be quarantined or not. So that's one of the total system. Mm-hmm. That's it.
And these networks come in response to perhaps the lack of ability to deal with the case with the MERS crisis.
Yeah, exactly.
I see.
Exactly.
Professor Park, speaking within your capacity as the former head of the risk communication at KCDC, I think, what can you tell us about the efforts that the government has made so far to better communicate with the public when compared with the case during the MERS crisis?
First of all, I guess we did not recognize the importance of the information disclosure, dissemination information. So, but after finishing the MERS, after we went through the MERS outbreak, we totally aware that the information disclosure is not only about life loss, but a lot of big economic loss. So, and then we're going to try to find some plan. The first one is about the Information Disclosure Act, which include contact tracing information. And another one is we try to set up the Office of Communication in KCDC, and also the important thing is that we have to make a risk communication guideline. At that time, there's no risk communication guideline, so we made it. And also another one is about networking. So the first one is internally. Each ministry has their own job. It's okay, but during the public health emergency, they have to get together. Like we have contact trace information. So we try to have a meeting on a regular basis and then made a network system. And also externally, we have a great connection with WHO and also ECDC, US CDC. So those have to be done during pre-crisis. So we are kind of responding. We are ready to respond. That's why we can get a more, I think we're going to have a little better job for this time.
Andres, what about in Spain? Does the public there have access to such vast information?
I'm afraid that's not the case. Some regions in Spain are starting to communicate some infection path information, but never in the level of detail as Korea. And as Professor Park just pointed out, I think what was very important here in Korea, not only of course because of MERS that happened in 2015, we didn't have that in Spain. Most of the countries haven't had an epidemic like that and did not, unfortunately, learn of the lessons learned in Korea. But one thing that Professor Park was pointing is how the system centralizes all this, and then literally what we're seeing is how you're getting all this information, and then it literally goes to every town hall, to every district office, and we get an alert in our phones, and it's there. Everybody's getting it. Everybody's getting it on a daily basis. That's not the case in Spain. And I'm afraid that in the current situation right now, hospitals are swamped, authorities are swamped with the number of cases and the number of deaths. This system might be useful and could be put in place, but after the curve is flattened, definitely. Right now, all the resources are put in this big emergency situation that we're living in Spain, I'm afraid.
Are there any concerns over violations of privacy, perhaps, if such information were to be available on a large scale?
Probably yes, but at this point, as I say, the situation is so bad that I think people could probably set aside those worries and then maybe contemplate the situation when things get better, I think, yeah.
Now, with regard to concerns over privacy violations, this is what Professor Schaffner had to say.
When there is a public health emergency, sometimes you have to not be so concerned about individual privacy so that everyone can function appropriately and avoid further infection. And different societies will have different tolerances of that.
Right. Professor Park, what is your stance on privacy concerns that have been raised by the government's use of surveillance tools to track COVID-19 patients, and how are these concerns being addressed?
Everybody concerns about that because it's very hard to tell. There are lots of pros and cons, and especially there's no exact answer about this. So, but it is obvious that when it comes to a public health emergency, most people maybe think that it's okay now, but the thing is that the more privacy getting kind of fringed or damaged by the authority. But the one thing is for sure that is this contact tracing and getting out information at the right time to the right person is a kind of core factor to prevent or control the the increasing the numbers of confirmed cases. So, but the thing is that this kind of maybe view on the privacy matters is totally depends on the each country's maybe views or their culture or their maybe ethnic or their civil awareness about that. So we don't have to be just simplify which one is right or wrong. So that's a totally different one.
And regardless of that, of course, what we do know is transparency in times of crisis can instill a sense of calm and comfort within the members of the public. Now, that is all the time we have for now. Thank you for being here, Professor Park. Thank you, Andres. We will be back tomorrow with more updates on the COVID-19 pandemic, so be sure to join us then. In the meantime, feel free to send us your thoughts and inquiries through our social media accounts and also check out our homepage at arirang.com. Thank you for watching.